fact that people will think, okay, once you have had a mental issue, then you can always go back. But tell us, as someone in the field, can mental health be completely cured?
No, when I started, I said there are many problems facing mental illness, and I said one of the problems is recognizing the symptoms, which we have talked about. It doesn't mean that until the symptoms are obvious before you approach the doctors, even the subtle ones. Another thing is what you mentioned, and that is the perception of the patient itself, and then the management. People perceive that patients are dangerous, you bite you become infected, and then you too become psychiatrically ill. Those are the problems. And even the management, they believe that, oh, you can never be totally cured. But I can tell you that there's what we call the rule of third. That is, one third of patients that have psychiatric illness can be totally ill.
Okay, just hold your thoughts there. Let's enjoy my next caller. Hello.
Hello.
Thank you for joining us.
I'm calling from Ghana, please. I have a boy. For the past 12 years, I've been going round and round. I've taken him to Peru on two occasions. He's on drugs. I mean, he has been on drugs, but they've been giving him drugs to cool down. But he cannot at the moment try to recollect his brain to know what to do. What else will I do?
Okay, Officer, thank you for calling. Did you get this question?
I think
we're talking about the boy, 12-year-old.
Yeah, that he has taken around. Don't forget I was talking about the rule of thought. That thought may get better completely. Thought may have cause to have relapses 1 year at a time. Then another thought may completely not get well. But even before you completely say that this person cannot get well, there are many factors. It's a wrong diagnosis, for example, if named. Patient is receiving wrong treatment. You need to make right diagnosis. And then even if you make right diagnosis, we have what we call resistant depression, resistant schizophrenia, or whatever. These drugs also have their own treatment. And with this drug, they have their own treatment. So what I'm just encouraging is that this is still the best bet. Prayer is good. If I have hypertension, I will pray. If I have diabetes, I will pray. If I have glaucoma, I will pray. If I have mental illness, I will pray. Everything will work hand in hand.
But you also take your drugs.
You take your drugs. So you should not be tired. You should go and let the doctors re-examine that patient and let them see. Maybe the patient is not taking drugs. That's one of the things. There's one called chicken. They just put it there. You ask them to open their mouth, they open their mouth, and you know what they said. They said, the man takes the drug and everything. They may not. So if he's not taking his drug, they need to give injections that will be in for the monthly injection. I think we need to ensure that right diagnosis patients taking.
Okay. We have another caller. Hello.
Yeah, good afternoon.
Thank you for staying with us.
Yeah, I want to ask your guest. There is a boy that I know is autistic. I want to know if autism is also a psychiatric condition. And the boy has been taken to various hospitals, including those. And as a matter of fact, the consultant neurologist in those, Dr. Meshi, actually confirmed that what the boy has is delay in language development and not really autism. So is this a mental condition as well, a psychiatric, it needed a psychiatric attention?
All right.
Thank you.
Thank you for calling. Autism, and now you brought in the case of children also having mental issues, challenges.
Yeah, you might remember I've been here to talk about autism before, sometimes last year. Autism, for example, is a pervasive developmental disorder. Under the autism spectrum disorder, you have autism, childhood disintegrative disorder, and other things. It's a syndrome. And in this syndrome, for example, Professor Leji is a pediatrician. It's a multidisciplinary approach.
He wants to know whether it has
It's
to do with the brain.
Yes,
Okay.
it has to do with the brain. For example, the causes of autism. For example, apart from the genetic causes, the memory problem, and the brain may become atrophied or whatsoever. And then this will manifest in form of autistic spectrum disorder. And the behavioral aspect. For example, the child who becomes dead hardly or in throws tantrum, then those are behavioral challenges. And it's usually because of these behavioral challenges that they come to hospital. And when they come, pediatricians will not see. That's not the time to be talking about speech delay. Because even if you hire a speech therapist, the guy is not sitting down. So you bring the child to a psychiatrist who was supposed to manage these behavioral problems. It's when the behavioral problems have been totally managed, then we can talk of occupational therapists, we can talk of speech therapists, we can talk of pediatricians, all working, behavioral therapists, psychologists, trying to modify the behavior of the patient. But there are medications you use for Tourette syndrome, autism, attention deficit disorder. These are all children problems, and we should not be deceived to say that children cannot have mental illness.
Okay, as we wind down, just give us some tips on, how to maintain a good mental health.
Thank you. Well, the most important thing is health is wealth, and challenges are external. Some of the things you cannot control. You must first of all believe that there are some things you cannot control. Know your limitation. Don't set too much goals for yourself. Don't try as much as possible to do it all. Have good sleep. Don't take substances. See the hospitals when you are worried, when you have some things challenging you. Go to the hospital and quick medical checkup, medical workup. Ensure that you live a peaceful life. Go with your creator, whatever religion, and try to be what God has made you to be. I'm not trying to say I want to achieve this, I want to be like my friends, I want to be like this, unnecessary pressure. When you recognize some symptoms, quickly run down to the doctor.
To the hospital. Thank you so much for coming on the program. And thank you all for watching. This is where we have to draw the curtains on health matters. Let's do this again next week. I am your May Otaiwe. Stay tuned for this track.